bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
I'm glad you could join us. Anyone who's read some of the new information about Medicare and Medi-Cal, I mean, you know, it's just a confusing kind of thing. And there are people who are trying to help folks out in getting through some of the pharmaceutical problems they may have. Tim Cutler is here. He is an assistant clinical professor at UCSF and also up at Davis at the same time, not a pharmacist. Tim, Partners in D. This is to help folks who are having a little difficulty understanding, and who wouldn't, some of the material that comes out to people, right?
That's exactly right. It's a very complicated benefit. Medicare Part D was new in 2006, but the thing that people need to remember is that it changes each year. New plans come, new plans leave, and even the plan that somebody may be in terms of the prescription drug plan, some of the aspects of that plan may change as well, the drugs they cover, etc.
Let me ask you this. Why does it change so much?
Well, that's a great question, and it changes because it's a free market type of approach where each plan has the ability to sort of adapt to what market needs they see. And so the confusion for the senior is that because it changes each year and there are so many choices to choose from, they have to look at it every year. It's not the same choices each year, and so it's very, very difficult sometimes for them to know to look at the plan options each year.
Okay, a new drug comes on the market, for example, okay? And this affects and they change policy because it may replace some other drug? Is that kind of, does that play into it at all or not?
It does, and of course the market changes in terms of what medications are available and what contracts those insurance companies have. And so the important thing again for those seniors to understand is because those things are constantly in flux and changing, they need to be proactive in evaluating their plans during open enrollment periods. And open enrollment for most seniors is right now. Actually started November 15th and it ends December 31st. So this is the optimal time to evaluate, and this is the only time for most seniors to be able to change their plans. And our recommendation is always to evaluate your current plan, make sure it's still going to be appropriate because there may be a plan that's less expensive for you.
Okay, one of the things you're involved, you're training pharmacists, young pharmacists to understand these things so they can consult with their patients and so forth. Most doctors are at a total loss to understand this stuff.
Well, we have several aspects of our program, and Partners in D is a statewide initiative involving 7 schools of pharmacy in California. And one of our main goals is to go out to the community and use the experience, expertise, and diversity of our student body to help seniors. So we actually are going out and performing community outreach right now. The second aspect is to train health professionals. Just like you're describing, we use our student pharmacists to educate future prescribers about the importance of knowing the Part D benefit and the ins and outs and how the Part D benefit can affect their patients, and the costs associated with the Part D benefit may affect the way people take medicines.
Yeah, well, anyone who's read that material has a great deal of difficulty. I don't care if you just went to grammar school or a college graduate. I mean, you're going to struggle with it and try and decide what is best for you personally. That's where the pharmacist has to come in.
Yeah,
right? Or the doctor.
That's exactly right. Everybody needs an advocate, and of course, you know, pharmacists know about medications, they know about the different prescription plans that are available, and so they are the most logical choice for people to actually work with. But the benefit is quite confusing, and so that's why we're training the future generation to really understand the complications of that benefit, and then to be able to explain it in a very clear way to individuals. And when we work with seniors, 9 out of 10 seniors find that they save money by working with us and looking at their plans each year to know what other options they may have.
Okay, because a pharmacist who's been in business for 40 years may be behind the curve also. I mean, that's another problem.
That is a possibility.
Understandably, by the way.
Absolutely, that's a possibility. And so our goal is to train those students, and then those students are going out in the workforce and they're working with other pharmacists to help them understand the benefit. And many pharmacists do understand the benefit, but sometimes they just don't have time. Exactly. So that's why the students come in. They really can make a big difference.
Tim, nice to have you here. Even though we may walk out confused, it's not your fault. Okay.